Welcome to Your Family's Health. This is Dr. Jeanine Cook-Garard, and I'm with Professor Joan Buckley. Hi, Joan.
Hello.
From the nursing department here at Nassau Community College. Your Family's Health is a program that focuses on healthcare issues and resources available here in Nassau County. On this show, we will be speaking to experts from around the country to keep you up to date on current healthcare issues and trends. Today, we will be speaking to Dr. Michael Setzen about the need for an ear, nose, and throat surgeon physician. So if you want to know more about how to stay healthy in Nassau County, stay tuned for the next half hour to the voice of Nassau Community College, 90.3 WHPC. Welcome to the show, Dr. Michael Setzen.
Hi.
Welcome. Can you tell us a little bit about yourself?
Sure. I am an ear, nose, and throat surgeon, which means obviously I take care of the ear, nose, and throat. My main areas of interest include the nose, the sinuses, snoring, sleep apnea, acid reflux, and I do rhinoplasties, and I'm sure all of those things we'll discuss during this next half hour.
Yes, and I also know that you are in private practice here in Great Neck also.
Yes, I'm in private practice in Great Neck. I am a clinical assistant professor of otolaryngology at Weill Cornell University College of Medicine. I have been the past president of the American Rhinologic Society and the past chairman of the Board of Governors of the American Academy of Otolaryngology, head and neck surgery. So I have been pretty involved in ear, nose, and throat issues nationwide and worldwide.
You know, this seems to be the perfect season for you. I know with allergies, and our summer seems to have carried a lot of it into the summer months where it used to be like a spring thing. But do you see that in your practice, that people complain of, say, sinus headaches or congestion more in certain times of the year than other times of the year?
You know, it is interesting. Initially, we thought it was somewhat seasonal, but now I do see it all year round where people come in with nasal congestion, facial pain, and headache. And what's interesting about the sinus headache, patients think that if they have pain in the region of the sinuses, it's always due to sinusitis. But what's interesting, it's not always sinus disease that's causing it. It may be other things like migraine or temporomandibular joint dysfunction, and that's why the ear, nose, and throat specialist plays a significant role in letting the patient know whether this sinus headache is due to the sinuses or not.
So how is it that you differentiate when a patient comes into your office to determine whether it is allergic reaction or whether it is something that is different? How do you make that determination how to treat?
Sure. So what happens is if the patient comes in with nasal congestion, facial pain, that's usually less than about 10 days, more than likely it's just an upper respiratory tract infection. If it continues beyond 10 days, the virus usually becomes bacterial, and then it could be acute sinusitis. So I let patients know that if it's beyond 10 days, it may be the sinuses. If it's less than 10 days, it may be a virus. Now, if they have nasal congestion that may be seasonal, they'll have itchy nose, runny eyes, itchy eyes, then it may be allergic rhinitis. But generally that 10-day period is the thing that's critical. Less than 10 days, it's an upper respiratory tract infection. Beyond 10 days, it may be a sinus infection.
Do you find that the people see their primary care physician first and try the less than 10-day approach with just maybe some antihistamines or something like that over the counter? Or do they come directly to you if they've had a history of problems with the sinuses?
Usually they'll go to their internist, primary care doc, or their pediatrician, but if it's something that's recurring, they get these infections, say, every couple of months, then they may come to an otolaryngologist or ear, nose, and throat doctor like myself. But initially they will go to their primary care doctor, and they'll treat them not with an antibiotic if it's less than 10 days. We try not to give the antibiotic. They'll give them a decongestant, something in the nose like Afrin or Niacinephrine, an antihistamine. You want to hold the antibiotic if it's bacterial. You don't want to abuse the antibiotics.
That is so important. I mean, with all the resistant organisms that we see now.
So when is surgery actually indicated for nasal congestion?
So what happens is first of all, we want to decide, is the sinus headache due to the nose or is it migraine? So what we'll do is we'll take a history, nasal congestion, post-nasal drip, facial pain, longer than 10 days, then it's an acute infection. If it's longer than 3 months, it becomes chronic sinusitis. And those are the cases we generally operate on. Those patients that have had the problem in excess of 3 months that have failed optimal medical therapy, which may be a cortisone nasal spray, an antihistamine, a decongestant, and antibiotics. So if they've failed medical therapy, which is the first line of treatment, then we'll go to surgery. And the surgery usually entails something called endoscopic sinus surgery. We use little telescopes to make little openings into the sinuses. We generally enlarge these sinus openings so the sinuses can drain better, they can ventilate better, they can aerate better. We can get into the sinuses down the road if ever they get a problem. It's a very functional operation. It's a safe operation. It's usually done in an operating room under general anesthesia. Patients have anywhere from 3 to 5 days of discomfort. They may not be able to go to work for those 3 to 5 days. And then generally we can help them with a success rate in excess of about 85%. The patients that we have most difficulty with are those that have significant nasal allergies. Now, the problem with those patients is, in spite of the fact that we did the surgery, they still may need to use an antihistamine and a cortisone nasal spray long term, but now the medication will be able to get into those sinuses and it'll work a lot better than before we do the surgery, because generally it doesn't get into the sinuses, so it doesn't help them, and that's why they needed the surgery.
So with this endoscopic sinus surgery, how long is the relief? So you're talking about a long term, a year, or is it just months that the patients can anticipate relief from their congestion?
So generally it's long-term relief in excess of 7 years in 85% of the cases. So this may be long-term. Now also when we do the surgery, the patient may have a deviated septum, or they may have swollen inferior turbinates. Those are the little membranes on the inside of the nose due to allergy. And what we'll do is at the time that we're doing the endoscopic sinus surgery for the sinuses, we'll address the deviated septum and address the swollen inferior turbinates. So we'll do something called a septoplasty for the deviated septum, and we'll shrink the inferior turbinates for the allergic manifestation of the problem. And those two additions to the endoscopic sinus surgery will help him with respect to nasal congestion.
Now, you spoke about your patients, obviously both adult and children. Now, with children, do you see that they're coming maybe more after the 10-day period, because kids kind of are resilient and they kind of just ignore a lot of things until it's like almost to the point where the parent sees a difference? Because I just know sometimes kids, they don't complain. You expect them to have a runny nose or whatever, or, you know, the swimming changes their voice sometimes if they've been breathing in too much water. Do you see children as being a real challenge in treating sinusitis, or even just, evaluating this congestion and that's lasted more than 2 weeks?
Well, that's a good question, because the average young child, under 12 and definitely under 8 will have adenoidal problems. So those kids that come in with a runny nose, their problem may be due to big adenoids. Mm-hmm. And what we find is they may get sinus infections, but we rarely have to operate and do endoscopic sinus surgery on these young children. So evaluating them, obviously we take a history, nasal congestion, runny nose. Then we put a little telescope into the nose and we can see the big adenoids. And if indeed they have big adenoids, we will first treat them again medically with decongestants, antihistamine sprays, maybe even an antibiotic. And if that doesn't improve the big adenoids and the sinus problem, those children may just need an adenoidectomy, which is also an outpatient procedure under general anesthesia. Takes about 10 to 15 minutes. It's a rather simple, safe procedure, and it gives them tremendous relief because it improves their nasal congestion, it improves their runny nose, and it can help their sinus problems. If that doesn't do the job and 3 months later they're still having sinus problems, then yes, we may have to do very minor procedures on the sinuses to improve the drainage of those sinuses. But those cases are very few and far between.
Wow. You're giving me the chills.
Yeah, what are your thoughts? I've had some sinus congestion from time to time, and I've always been steered away from the over-counter nasal sprays because of the addictive, they have some addictive qualities to them. What are your thoughts about those?
No, that's absolutely correct. When I say nasal sprays, the two sprays that we recommend are saline nasal sprays and cortisone nasal sprays. Okay. We rarely give the decongestant nasal sprays, which vasoconstrict the inside of the nose, like an Afrin or an epinephrine, for more than 3 to 5 days at an absolute maximum. Okay. Those patients that are using those sprays long term do become addicted to them. The nose swells up because now they need it, and every time they shrink the nose down, it swells up more. So we discourage those patients from using the decongestive vasoconstrictor nasal sprays. Rather saline. Saline is actually the best thing for the nose, in particular children. The cortisone sprays in kids, we want to give it for a short period of time. Adults as well, don't give it too long. And don't give cortisone sprays to adults that have narrow-angle glaucoma. That's the only time we get concerned about the cortisone sprays. Other than that, the cortisone sprays are safe.
Wow. It's a little early, but I think this is a good time for a break because we have a lot of things to talk about when we get back. So you're listening to Your Family's Health and the voice of Nassau Community College at 90.3 WHPC. This is Joan Buckley, and we have Jeanine Cook-Garard, and we have Dr. Michael Setzen here. And we're going to continue talking about what's involved in an ear, nose, and throat exam or evaluation after the short break.
Let's go inside the mind of a 10-year-old.
I should have worn those earrings today. I like those earrings. Gabby has those awesome earrings. I need to ask her where she got those, but that's just what she would want me to do. I'll have Michaela ask her for me.
Buckle up, Sarah.
Yeah, but then Michaela will be like, why don't you just ask her yourself? That's just like Michaela.
Sarah, buckle up.
Michaela's such a great name. I wish I was called Michaela. There's like a dozen Sarahs in my class.
Hey, we're not hitting the road until you buckle up, honey.
Oh yeah, seatbelt. I forget sometimes because my brain is busy, I wonder if there's pizza at school today.
Sometimes it can be tough to get through to your kids, but it's not impossible. Always make sure they're wearing their seatbelts, even on short drives. Remember, you have the keys, you have the power. Never give up until they buckle up. A message from the National Highway Traffic Safety Administration and the Ad Council. Visit safercar.gov/kidsbuckleup for more information.
WHPC.
Welcome back to Your Family's Health. This is Dr. Jeanine Cook-Garard, and I'm with Professor Joan Buckley. And we welcome back our guest, Dr. Michael Setzen. Hi, Dr. Setzen.
Hi.
We're back, and we just picking up from where we left off, talking a little bit about ear, nose, and throat surgery and some of the care that goes into treating patients that have sinus headaches or sinusitis. We'll just talk a little bit about people who are concerned with getting a nose job, and this may be cosmetic, or it can be from any kind of medical, maybe a deviated septum you're talking about. How do you examine somebody, and how do you determine whether it is indicated for someone that has a deviated septum or wants to come in for a cosmetic change in their nose?
What we generally do, obviously, the first thing is we'll take a history from the patient.
Mm-hmm.
Do you have nasal congestion? Do you have postnasal drip? Are you getting attacks of sinusitis with facial pain and headache? Have you tried medical therapy? If indeed they say, medical therapy hasn't done the job, I'm still congested. And then we say to them, also, are you happy with the appearance of the nose? And many of those patients are coming in because they're a little afraid to say they don't really like their nose. And at that point, they'll say, Doc, I do have nasal congestion, but I also dislike the little bump on my nose. And while you're, taking care of me to make me breathe better, can you help me with respect to the outside and make me look better? So when we think of rhinoplasty, we always think of it as two parts, function and form. We don't only want to make the nose look better, we want to make it work better, because one of the worst things that patients